Hi ladies and gentlemen, my name is Karen Waters and I'm the Principal Physiotherapist here at Goulburn Physiotherapy Centre. I've been treating men and women with urinary incontinence for over 7 years, and I'd like to take just 3 minutes of your time today to provide you with some information on urinary incontinence and how you can take control of this matter. Urinary incontinence is the unwanted leaking of urine. It's more common than you think, with up to 37% of Australian women and 13% of Australian men reporting symptoms of urinary incontinence. Alarmingly, over 70% of people suffering with urinary incontinence do not seek treatment and advice for their problem. People often joke or make light of the fact that they leak when they laugh, cough or sneeze, or that they constantly have to find a bathroom when they're on a walk, out shopping, at the movies or on a bus trip. Urinary incontinence is no laughing matter. It might be common, but it is never normal. Urinary incontinence is not just suffered by elderly people, women who have had babies, or men who have had prostate surgery. Urinary incontinence can also be experienced by younger adults who play a lot of sports or train vigorously, people who suffer with chronic constipation or urinary tract infections, people who are classed as obese on the body mass index range, and people with chronic coughs. In many cases, incontinence can be prevented and well managed by adopting healthy diet and lifestyle habits. Some simple aspects of your health to consider in managing and preventing urinary incontinence are the amount and type of fluid which you consume daily, the types of food which you eat, in particular the amount of fibre in your diet, maintaining an ideal body weight for your height, managing chronic coughing associated with smoking or other respiratory conditions, and achieve 30 minutes of exercise most days. However, if you do suffer from incontinence, make sure you see an appropriately trained health professional to make sure that the exercises that you're doing are pelvic floor safe. Practice good toilet habits. Don't get into the habit of going to the toilet just in case. Only go when you feel the urge to go. And one of the most crucial tips for managing and preventing urinary incontinence is doing your pelvic floor muscle exercises and doing them correctly. Now, if you're not sure how to do a proper pelvic floor muscle exercise, or if you've been trying these exercises for more than a few months with no improvement in your urinary incontinence, take the next step, call the clinic and make an appointment to come and see me. We will discreetly work through your urinary incontinence issues and determine if there are any other factors that may be impacting on your pelvic floor muscle function. I will make sure that you're not wasting your time doing the incorrect pelvic floor muscle exercises, and we can discuss any other aspect of your health which may require input from a GP or specialist. I'm a member of the Continence Foundation of Australia, a registered health professional and appropriately trained to assess and treat urinary incontinence in men and women, as well as provide pelvic floor safe exercises. Remember, urinary incontinence is no laughing matter. It is not normal. So regain control of your bladder and regain control of your life.